Okay. Hi, my name is Mark Gauthier, and this is the Pediatric Respiratory Compromise Skill Station. I'm here all alone at the station right now, so I'll be doing this by myself without an examiner, but I'll be sure to verbalize when someone is taking over bagging for me, like for example, because you don't want to hit that critical failure where you're not bagging for any 30-second period of time. But with that being said, I also have looked over the sheet a few times, and I am pretty confident that I know when the examiner pitches in and says things, so we'll see if my memory proves what I'm saying correct. We'll see if I can remember it all. But I feel pretty good about it. Anyway, without further ado, let's get it going. So, show up on scene. Scene safety, got my PPE. First I want to go to my patient, get my general impression. General impression is that I have a baby, pediatric patient and respiratory compromise. I want to look inside the airway, see any vomitous secretions, nothing the baby is choking or obstructing the airway on. I also want to be examining the breathing, looking at the rate, the depth, so look at that. After, I'm going to put my SpO2 on the patient. SpO2 will then tell the examiner to tell me that it's 82% and that my baby is in pediatric compromise, in respiratory pediatric compromise. And at this point, I want to act quick and get them oxygenated, pick a non-rebreather mask, pediatric size on, and I'm going to put it on 10 liters per minute. I also have determined that this baby is unconscious, so that is the level of consciousness it is in it. Great. And at this point, I want to be checking for pulse. Okay. Checking for pulse. I want to be taking baseline vitals. And at this point, I also can be checking for skin color, see if it's cool, and check perfusion, basically what you're doing. And at this point, examiner is telling me that, there is decreasing SpO2, decreasing pulse, there's head bobbing, seesaw respirations. And at this point, I would really consider putting in an advanced airway and breathing for the patient. So while I'm doing this, I will size my adjunct first. First thing I want to do, size from the corner of the mouth to the tip of the ear. That's good. Okay. And this, we want to do this fast so the child is getting the respiratory treatment it needs for the most amount of time as possible. So on 3, we'll go 1, 2, 3. There we go. Patient. Put it in, and then you want to actually tuck it under the lips on top of the teeth because the lips will help hold it in place. And great. And at this point, tilt the head back and start breathing for the patient. We want to do every 3 to 5 seconds, or 12 to 20 per minute. And we also want to, so we'll have someone else help me out do this. So they're still breathing with the bag valve. I'll have my fellow AEMT keep breathing for me while they're covering me, still doing that breathing rate. We want to attach it to oxygen. We want to do that as soon as possible, and then we can put it on high flow, so we'll turn it up from 10 to 15. Great, and I can take over again from the person helping me out. Every 3 to 5 seconds, good. And one way we know that the airway is in the right place and that the air is going where it's supposed to be is that we see equal bilateral chest rise. We can also attach it to capnography, a little extension right here and here. And then that'll also tell us lots of information, like if we are breathing too fast, then we'll have low levels recorded on the capnography. So yeah, that's it. And get ready for rapid transport to the hospital. And that is the Pediatric Respiratory Compromise Skill Station. Thank you.